So my name is Rahul. I'm a second-year internal medicine resident here at Penn.
Hi, I'm Michael McFall. I work with the hospitalist service.
And we're here on behalf of the Bridge Project. Our goal, to link hospitalized patients to follow-up appointments. So let me start by telling you guys a little bit about why we chose this project to work on. For patients leaving the hospital, post-discharge follow-up appointments are a key component to getting them out of the hospital and keeping them out of the hospital. I've been on both the inpatient and the outpatient side of the story myself. As an inpatient, all the time, we say, you know what, we think Mr. Jones needs cardiology follow-up in 3 weeks. I call his office, they say, can Mr. Jones do next Tuesday at 4? Sure, why not? I booked the appointment on his behalf, and that's that. But then on the outpatient side, I've had plenty of visits scheduled to me as post-discharge checkups that they no-show. Somewhere along the road, we realized something doesn't quite match up, and we looked into it. We looked at 10,000 appointments at HUP on medical floors in the last year and found that less than half of them were kept as scheduled. A full 28% of them no-showed or canceled the same day. Why does that matter? Obviously, it's bad for that patient who doesn't have a chance to be seen, but also for other patients when you have 28% of your slots go unused on any given day for Penn providers. It's also bad for the healthcare system as a whole. Why? Missed opportunities. By our calculations, close to $1 million in reimbursement was lost in the fiscal year 2015 on medical floors alone across HUP's hospitals. More interestingly, literally in the last week, hot off the presses in JAMA Internal Medicine, 1,000 patients, including several patients at Penn, were studied, and they found that for preventable 30-day readmissions, those patients had nearly 3 times the odds of having missed a discharge appointment from their index hospitalization. Clearly, we can do better, and that's what we chose to work on. We cycled through several pilots initially, trying to validate our initial assumptions. Our first assumption, the one that I was sure was going to be correct, was that patients don't show up because they have no skin in the game. They didn't book the appointment. They have no reason to show up. So we actually talked to a bunch of patients and found that that's not the case. Many of them actually preferred to have their doctors book the appointments for them. They just forgot about the appointment entirely. So then with our second pilot, we thought, well, maybe the reminder systems that we use are bad. Maybe they're getting automated phone calls sent to a number that was disconnected 4 years ago. We actually tried those numbers and found that, by and large, they're correct. The phone reminders could be improved. We found that for a lot of patients, a 72-hour phone call wasn't enough for them to book logistic care or get their family members to arrange transportation to the appointment. But overall, this assumption was false as well. What was true was that regardless of all of this, they were forgetting about their appointments. So we changed our pilot question to, instead of why are they not keeping their appointments, why are they forgetting their post-discharge appointments? And that's where we had our aha moment. Let me present to you actual discharge instructions that I gave to a patient that I discharged 2 weeks ago at HUP. I challenge you guys to find his post-discharge appointments buried in the sea of 12-point text. I'll tell you where they're not. On that first page where it says important discharge instructions, it says make a plan to exercise. It does not say make a plan to remember and keep your follow-up appointments. From this, our third and final pilot was born, and I'll turn the podium over to my colleague Mike to explain further.
Thank you, Rahul. Our project team created and tested a series of pilots. Initially, we began calling patients several days after discharge to discuss appointments, instructions, locations, etc. It became very clear that many patients were discarding or losing their discharge paperwork. This prevented us from having an in-depth discussion about appointments with their PCPs and their specialists. A second pilot consisted of visiting with patients during their hospitalization. Overall, this proved to be helpful. However, patients would often forget our discussions, and data tracking results were not as favorable as we had hoped. Acting on insight leads us to our primary pilot, which took place over an 8-week period on Founders 14 at HUP. A dedicated group of discharge nurses closely reviewed post-discharge appointments with the patient, their loved ones, and/or close friends. Patients were given the option of documenting their appointments in a color-coded take-home calendar provided by the discharge nurse, or by using the calendar in their smartphones. Here is an example of a simple yet effective color-coded calendar, as you can see right here. As you can see, patients circled the date of the appointment and added appointment specifics at the bottom of the page, such as specialty, location, clinic phone number. Finally, patients were given the option of providing the discharge nurse with a cell phone number. This cell phone number will be used for post-discharge communication via text message. So what were our results? Over an 8-week period, 52 patients were enrolled in this pilot with a total of 56 post-discharge appointments scheduled. Of the 52 patients, 17% of these patients opted to receive post-discharge text communication. Of the patients enrolled, appointment compliance was 80%, compared to 43% on our parallel floor. So almost nearly double patients who were enrolled in our pilot. Patients who opted to receive post-discharge text messages had an overall 100% compliance rate with their appointments. So a great example of a target patient I would like to point out, we had a gentleman who was status post right femur fracture repair. He also had active MRSA. The patient was provided with a color-coded calendar, and he opted to receive post-discharge text communication as well. The patient had no support, no friends or family in the area. The patient was scheduled with infectious disease and orthopedic surgery post-discharge. After discharge, the patient informed us via text message that he had no transportation and was unable to get to any of his appointments. Our project team managed to set up transportation to and from his appointments, and we are happy to say that he made both appointments and is now receiving the post-discharge care that he should get. So what did we take away from this pilot? It is basically simple. It is taking a personalized approach to communicating and documenting follow-up appointments both at and after discharge. Greatly improves overall compliance.
Thank you, Mike. So on a broader level, why this matters. He kind of touched on this already. In the interest of time, I won't go into this much more, but we're talking increased savings, healthier, more engaged patients, and potentially a lower rate of preventable readmissions. More importantly for us, if you look at the ROI, between this Mike, the other Mike, and our 2 discharge nurses, we came up to about 20 hours a week between 4 people to make this a reality. All we needed, paper, printer, pens, and a phone. Not too bad considering how important of an issue this is. So, in conclusion, we'll kind of talk about our next steps. If you forgive my cheesy animation here, how do we continue to move the needle on post-discharge appointment attendance? Step 1, of course, is to expand our pilot to other medical floors. We're thinking potentially 2 or 3 other medical floors at HUP in the next 6 months. Step 2, though, we would love for this to be part of a comprehensive package to get patients to their appointments. The reminders, I'd love for them to have an N of 1. What do I mean by that? Not every patient is the same. Some may say, the phone call's fine. Some may say, you know what, text me. Some may say, email me. Some may say, don't talk to me. Send a reminder to my son who'll be getting me to my appointment. And lastly, I would love to blow up this idea of reminders and turn it into an engaging conversation. As Mike pointed out, of our 11 patients that had the actual texting conversation back and forth, 100% of them made their appointments with our help. That would be a great direction for us to move forward. We're a young project. We have a lot of room ahead of us and a lot of room to grow. And regardless of what steps we end up taking, our goal is to create, as our project title alludes to, a bridge. A comprehensive bridge between inpatient and outpatient. A bridge that will keep our patients out of the hospital, keep satisfaction at an all-time high, and keep us, Penn, at the forefront of patient-centered care.